The current trajectory of the tech industry is a race to automate professional services entirely, pushing to replace human judgment with autonomous code. Apply this fully autonomous approach to high-stakes fields like cancer diagnosis, legal counsel, or pediatric care, and the risks multiply rapidly. The regulatory reaction to those risks is often just as blind. Over the summer, the Federal Trade Commission threatened to preempt state chatbot laws entirely, trying to stall the technology by throwing up a roadblock. This creates a dangerous vacuum. Tech companies push forward for complete autonomy, regulators reach for outright prohibitions, and almost no one offers a practical blueprint for safe deployment in the middle. But the actual solution to AI safety isn't writing smarter code. It is designing the exact moment the machine stops, a solution independently discovered by 3 unconnected experts. At Tufts Medical Center in Boston, Dr. Michael Paasche-Orlow has spent over a decade working on health literacy, focusing on whether a patient can actually understand and use the information their care depends on. The National Cancer Institute is funding his work through a $663,000 grant to build ECA Pro. It is a system designed for patients undergoing long-term cancer treatment. The system uses an embodied conversational agent on the patient's smartphone. It simulates face-to-face communication, using voice, hand gestures, and gaze cues, showing empathy in English and Spanish to keep patients engaged while collecting their reported symptoms over time. This diagram shows the most critical feature, a hard boundary. The agent gathers answers, but hits a hard wall here. It cannot diagnose. Instead, the AI packages those answers into a clean visualization, handing them to a human oncologist who makes the actual decision. By drawing an absolute line between data collection and medical judgment, the clinic proves that the machine does not need to diagnose to be valuable. While the federal government stalls, Colorado Attorney General Phil Weiser has built a proactive framework at the state level. Just 5 weeks after the FTC threatened to preempt state laws, Weiser's office filed detailed proposed rules to implement Colorado's Chatbot Safety Act. The rule lists specific duties: estimate a user's age, disclose the AI identity, and establish strict response protocols. But the most critical legal boundary in the proposal addresses professional boundaries. A chatbot's output cannot ever be represented as equivalent to a licensed professional service. Colorado took the abstract engineering concept of keeping a human in the loop and wrote it into a concrete, legally enforceable mandate. At Nationwide Children's Hospital in Ohio, researcher Emre Sezgin is running a pilot clinical trial for a chatbot named DAPHNE. Statutory language about AI in pediatric settings usually assumes the bot is talking directly to the child. The DAPHNE trial uses a completely different architecture. This user flow map illustrates the choice. The AI communication line bypasses the child entirely. It routes exclusively to the adult caregiver to ask about unmet needs. DAPHNE then takes the caregiver's responses and routes them straight to a licensed pediatric primary care team. The vulnerable subject in this design is physically insulated from the machine. It is a deliberate protective choice that shifts the AI burden solely to the adults in the room: a physician in a Boston clinic, an attorney general on a Colorado docket, a researcher in an Ohio children's hospital. None of them chose to ban artificial intelligence, but all of them completely rejected the tech industry's push for autonomous operation. Every one of them succeeded by writing down the exact moment the machine has to stop, and then explicitly naming the person who takes over. This shows that keeping a human in the loop is a rigorous design discipline. The most important feature we can build into the future of artificial intelligence is the brake pedal. Bounding machines and keeping human oversight close by is exactly how the technology becomes useful in the real world. And that philosophy is why Clinician Assist Inc. sponsored this video. They build software aligned with this exact principle, keeping licensed clinicians firmly in charge of their AI tools.